We're learning more about a possible coronavirus treatment that was given emergency authorization by the FDA yesterday. President Trump called the announcement a breakthrough in dealing with the virus, but there's some doubt as to how effective it is. Fox 5's Misha DeBono spoke with the doctor here in San Diego about it.
Well, like all things coronavirus, there's just so many unknowns at this point, but it's important to know there's a very big difference between authorization and approval. At this point, there is just not enough data to support the evidence that the plasma actually works to treat coronavirus, but they say it may or it may not.
The thinking is that in theory, it does help with patients that are currently sick from it. So if you give them plasma from someone who's recovered from an illness, then those antibodies can help someone who's currently fighting the infection.
Right now, according to the FDA, more than 70,000 patients have already been treated with convalescent plasma, which is made using the blood of people who've recovered from coronavirus infections, but only in an experimental application.
An authorization requires a lower burden of proof and a lower level of evidence than an approval. So in this case, there aren't enough trials yet.
An emergency authorization normally paves the way for expanded or widespread use of an experimental therapy. But the FDA did not fully endorse plasma because so far there have not been enough controlled clinical trials that prove the therapy actually works. In fact, the FDA held off authorization last week over concerns from government scientists that evidence for the treatment's effectiveness is thin.
So the study that you're talking about is from the Mayo Clinic, and it's more so what is called an observational study, again, which is a lower level of evidence. And so what they found was that there was a 35% improvement in mortality 30 days out. And so that means that it possibly conferred some benefit, but it's hard to say whether or not there were other things that helped with that.
So it begs the question, what's the harm, if any, of speeding up an unproven therapy?
So you can have an allergic reaction and you can have lung injury. There are actually some serious reactions an injury that you can get to your lungs. For example, there's something called a transfusion-related lung injury. These are not, trivial side effects.
So clearly more data is needed. Also, you might recall that hydroxychloroquine was also FDA authorized, and then they pulled that authorization after clinical trials found that it really had no benefit. From Encinitas, Misha DeBono, Fox 5 News.